A week after the floods caused by Storm Daniel, he ruined East Libya, killed thousands of people, and changed more, and survived faced another threat: water contamination. Health officials, especially in city Zorlu Derna, in the affected areas spread diseases. Water-based diseases are alarm. Experts warned that flood waters are seriously dirty by sewage, made them insecure for consumption and expose communities to health risks. Here are some important questions about the situation. What is water contamination? Water contamination occurs when the groundwater water a distribution system enters drinking in the source of germs and chemicals, for example, from lakes, rivers. According to the World Health Organization, contaminated water and weak sanitation, cholera, diarrhea, dysentery, hepatitis A, typhoid and children's paralysis are linked to the transmission of diseases such as palsy. How is the problem in crisis strokes? Essentially, through a combination of short-term and long-term measures. The International Red Cross spokesman Jessica Mousson said, in the first step of Mousson, he explained that it is to provide safe water for consumption, whether for drinking, cooking or hygiene purposes. In long term, in addition to other measures involving chlorination of public water resources and the spread of information about secure water applications, it is mainly repairing necessary infrastructure. What is the scale of water contamination in Libya? This has left its infrastructure in tatters and made it more vulnerable to disasters. Mousson said last floods have caused serious deterioration, including water infrastructure, which combines the challenges of country. Although it is difficult for certain figures to come, impact of disaster on sewage systems means oil risk of population to contact with unsafe water. According to United Nations Human Affairs Coordination Office, at least 150 people were ill during the last 10 days since flood, including 55 children in Derna. In the International Rescue Committee said in a statement, the situation in other parts of Derna and Libya is terrible. Access to clean water is a fundamental human right, and we are worried about the health and welfare of those affected by this contamination crisis. Many local and international aid groups, including Libya Red Crescent and UN agencies, have responded to disaster by providing emergency assistance efforts. The response varies from evacuating residents, providing medical assistance and basic materials, to providing safe water and sanitation equipment prevent the retention of diseases. Humanitarian assistance also requested additional financing to scale operation responses and reach the more affected inhabitants in Derna and surrounding area.